Alright guys, I'm going to take you through the lacrosse ball recovery routine. So the purpose of the lacrosse ball, when we're talking about our lower body, is just to release muscles that are too hard to get at with the foam roller. Essentially we're doing the same thing as a foam roller. We're trying to increase the recovery so you have less soreness and reduce injuries. So less tight muscles and better tissue quality, better circulation. So what we're going to focus on are the hips, hip flexors, and hamstrings for this routine. So for the hips, we're going to place the ball here, so above your hip pointer and the crest of your hip. Big chunk of muscle, which is kind of your hip flexor, and a couple other hip muscles in there as well. And we're going to wedge that ball against the wall. So you're going to press your hip into the wall and roll side to side. Once again, it's going to feel pretty painful on a lot of people. And you want to roll until that pain kind of subsides. If you start at a 7, you want it to go down to about a 2 or a 3. And there's a good chance that that muscle has released at that point. The second area that I want you to focus on, and you'll need a bench or a chair for this, is your hamstring. So for the hamstring, what you're going to want to do, start low and then work your way high. And you're just going to put the ball underneath your leg on a hard surface, lift your leg, and put down pressure on it, and roll side to side on those 3 hamstring muscle fibers. You should be able to get in pretty deep on that one. And then lastly, what I want you guys to hit, because this muscle also gets pretty tight, are your spinal erectors. So the muscles in your low back, low and mid back, along the spine, but not directly on the spine, just beside it. So 2 ways to hit this. Place the ball on those low back muscles and you can go up and down. Or you can hit it from the side. And the side seems to release a little bit better in that area. So rotate your hips. And you're going up and down on that big slab of muscle in your lower back, spinal erectors.